Good evening, good evening, Fambulem. I'll say una week be go fine and una get a good weekend. Today we dey talk about cancers. Today na World Cancer Day and we wan talk about wetin na cancer because this na word wey fearful. People dey no dey able for talk about am. E so fearful, na hush hush hush. People dey not even want for mention am before that they can say, oh, na the big C. So today we dey talk about this big C because itself dey on the increase all over the world. Although other sickness than dey like diabetes wey dey kill people dem more than how cancer dey kill people dem. But the theme for cancer, for World Cancer Day today, na for make we say we dey raise awareness of cancer for let people dey know, say dem for go get early detection and for let them get treatment. Because any sick, like I can always say, if you pass before that sick day, you able for know say you get you can able for cut out for make you know ambog you too much. So today na World Cancer Day. We dey talk about cancer and how we people in our salon they cope with this cancer. Cancer itself, like what we always talk about non-communicable diseases, cancer na one non-communicable disease. Although itself can be hereditary, like the diabetes or the hypertension, but that's a thing where if you touch person because you get cancer, you self will get like an infectious disease. Cancer not infectious, but you can get them from your family, like your mama, your papa, your brother self. Some cancers, and if you didn't have the family, your brother get them, you self can get them. So wetin na this cancer what we dey talk about? You see, we body makeup na cells that we body makeup. We dey always talk about cells there. Like when I can talk about diabetes, I dey talk about cells there. Cells then are the building block of we body. For let somebody even get energy, the food wey they eat, wey it turn to simple sugars, they get for go inside in cells and for let that person they get energy. If your cells they not get adequate energy, you go always weak. We cells dem na things dem wey dey grow, then dey old, and then dey replace themselves with new one dem. When e come to cancer, wetin dey happen? You cells dem wey suppose for old and die, dem no dey old, dem no dey die. Wetin dem dey do? Dem dey multiply, dem dey plenty, dem dey plenty, dem dey plenty. So when dem plenty too much, dem dey go gather one place. This one place wey dem dey gather now, dem get a big bunch of dem. Na im dey turn to tumor. So na that na cancer. We cells dem dey grow uncontrollably. You no dey able for say this na the amount of cells dem just dey multiply, dem just dey add, dem just dey add, dem just dey add. When dem don add tey, then dem go bunch one place now because dem no dey able for do anything for the body. Then dey go now, dem go bunch one place. This bunch wey dem bunch one place, then turn to something wey na sickness, wey na tumor, na im dem dey call cancer. So I hope say we people dey understand that. And this cancer like wey I say, people dem no dey talk about am so. Most homes dem, if dem dey talk about am, even if somebody get am, na hush 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 hush. Nobody no dey really gree for talk about am that way dey. But wetin World Cancer Day in theme, e say I am and I will. I am raising diabetes, I'm raising cancer awareness right now, and I will raise cancer awareness all the time. Because if we raise awareness of this disease here, so we go able for make people then go get early detection, and we go able for make the people that we don't detect say they get an early, then we able for get cure. Okay, now we get boku cancer, but today we want to talk about breast cancer. Breast cancer and prostate cancer, the boku na mama SALONE. Even the cancer charity wey dey SALONE, they get a cancer register now. Cancer na one of the non-communicable disease wey dey SALONE, we get a register where we get big doctors, we get big woman wey some dey comot America, some dey comot London, they don come put more power on this cancer. So for let we get a register, let we self know say okay, SALONE they get almost 1,000 cancer patient there. So that help go come for them. For where they don't tell you say now your life done because of this cancer, who say you go dey, where they go bio you, who say you go dey, where you go eat and be happy because you can die anytime. Because cancer na sickness this way, if you not caught before it go kill you. And some people then, some cancer they by the time they tell you say you get this cancer, so they go say na 2 months you get for leave, or even 6 weeks you get for leave. Inside this year no more. Last year we don lost people that were very close to we, man them or woman them or especially Sierra Leoneans, even when they are the diaspora, but who don't die because of different cancer. Some cancer they not they give you any symptoms. They not they show you say you get this sick. That's not the symptom. They not they show you say this person get lung cancer, or this person get kidney cancer, or this person get brain tumor, or this person get lung cancer, liver cancer. You know they know because you know they show no symptoms. So where this kind of thing happen, by the time they go tell you say you get the cancer, they will just say you how many months you get for leave. We're very bad. So now I make World Cancer Day, they tell we say we for raise awareness for early detection, because any sick, and they continue for say any sick where you get, if you cross before them, then tell you say you get this sick, you will able for know you for able for know how for treat this sick here. So on that note, I want for make we play one of we video where they tell we a bit about cancer. So now we listen to we first video where now from doctors then they talk about one particular cancer where we they talk about tonight. Thank you.
Breast cancer is a leading cause of cancer deaths among women in India and worldwide. It is the #1 cancer with an incidence of 26 per 1 lakh women population. And Bangalore is rapidly becoming a breast cancer capital of India. The incidence of breast cancer is increasing in the age group of 30 to 40 years, and breast cancer behaves very aggressively in this age group. So what are the symptoms? Breast cancer can present with a painless lump in the breast, or any change or discharge from the nipple, or swelling in the armpit. So what are the screening procedures? Clinical examination by an oncologist or a physician and mammograms done yearly starting from the age of 40 years is recommended for breast cancer screening. Breast cancer is potentially curable if detected early. Due to advancement in surgical techniques, chemotherapy and targeted therapies, breast cancer patients are achieving long survival and very good quality of life. So the bottom line is early detection can save number of lives. So ladies, pay attention to yourself, get screened and lead a healthy life.
Okay, una thank you. Una don't listen to that video. Wetin is stress on is early detection. If you go, they go screen you for breast cancer. When they do every year, na UK, na the diaspora, we say all the big hospitals, then they even in SALONE now. They don't make and say anybody where you want for know if you get this breast cancer, they get clinics there. They get well woman clinic, they get well body clinic, they get Aberdeen women's clinic. If you go there, you're not sure, you will go there for me, then go test you. What's in the sorry, what's in that doctor mean? They say gist now. For me, you know, say breast cancer, they cancel you. You know yourself as girl picking, where you don't full grown, you know how you bobby day. If you don't born picking, you're not born picking yet, you know how you bobby day. Once now you see you get lump now you bobby. So I say this lump now they hurt you, but in not blunt they. You they go let them go look you. And they talk saying that doctors or physicians they go look you, but we get nurses that we train for me to examine you, Bobby, and tell you say yes, lump there, and then they go do series of tests. Them they go do boku test or take blood test. They go even take parts by your body for go test and for see if that lump where they see na your body na cancer lump. It not go hurt you, someday go hurt you. Then you go see you bobby the nipple back, the mots of the bobby where pikin can suck. Some people that the way they get the breast cancer, the bobby mots will be comot, it they go inside. Now they call inverted nipple. That bobby nipple they just they go inside now. Like say that you push her inside with your finger. If you see something like that, then now you bobby, go hospital. Sometimes you're not so belle woman, you're not so kumra. You they see you bobby they pull water. If that they back happen to you, do ya? Now for go let them go test you. Because all that in a sign for sure say something don't change now you bobby. For me you go let them go look you. So now that now the bobby in your side where that doctor don't say. And the go say this now between the ages of 30 and 40, now this cancer also they strike woman them. So if you're in that age group there, always if you go to the hospital self, then they teach you when they can you host every month how you they touch your bobby, you self for let you know say nothing or they no lump, no they way you not sabi. And when they talk about breast cancer, we just remember woman then. When we say breast cancer and woman then we remember. But we now know back say some man self they get breast cancer. Because breast cancer na one of the cancer them back where you they get from your mama. So some man then they so tell where them where the way they make, they get some parts by them body where the hormones then they affect themselves. They go get some hormones the way go make they can't get this breast cancer because their mama been get her. If they look TV for the good reasons, would they watch news for the good reasons, not so for just watch news for learn how people they cause, or for learn how people they work are naked, or for learn how people they take drugs. If you learn news, you go know say boku celebrities then they where their mama then die of breast cancer, waiting and they do, then they go do the surgery. let them pull them body once and let us sick self not cancel them. So now how bad breast cancer dey. So we not for play with am. I know celebrities there, una wey dey watch news, where they watch their celebrities, and una know say somebody like Angelina Jolie, we act Tomb Raider, e don go cut or two in bobby comot because e no wan forget breast cancer because im mama die of am, im aunty sef bin get am. So I been dey talk say man sef dey get breast cancer, so not a woman dey no more. So let we know say na the cancer that the way they happen to man and it happen to woman. On that note, I want for see who that they don't can join we for let we welcome them and ask them for let themselves contribute to wetin we dey do now. So if they get anything for add to wetin they say, let them feel free for do so. If they want for call in with contributions, if they want for call in for ask questions, they're free for do so. So let we see if people that don't join we so that we go welcome them. If not, I will just say, well, let we welcome the people that already don't join VOS. Let we welcome them. Let them know say today na World Cancer Day and we dey try for raise awareness of cancer for let people that know say early detection and treatment will save their life. So now that's the thing we talk about today. So if we talk about cancer, we look a country like USA. USA when a big place. Breast cancer bokude say bokude. The next one we bokude na lung cancer. The next one after that na prostate cancer. So this na the National Cancer Institute now bring all the statistics here say most of the cancer them back na the skin it is start. You dey see them they say this person get cancer na in body is start. Too much exposure to sunlight. Some people then they win and they go lead on a sun they burn them too much, especially with Caucasian people because for let you see black person suffer skin cancer. It dey but not plenty like we Caucasian and people them. So skin cancer, the boku, the lung cancer boku, the prostate cancer boku. So now that's we don't talk about about breast cancer. Now the other cancer we want for more could talk about na prostate cancer. Prostate cancer itself don't boku na SALONE. I don't mean 2-3 people that inside this new year no more. When they don't diagnose them with that prostate cancer, then get for go do operation. Someday they get the money, then they fly and go overseas for let them go do this operation. So we get bladder cancer, we get colon and rectal cancer, we get endometrial cancer, kidney, we get leukemia when a cancer of the blood, and then they back in boku in small picking there. We get liver cancer. We get lung cancer, we get pancreatic cancer. Somebody died last year, we're very close to me. Now pancreatic cancer, they get cancer of the pancreas. Picking that we get type 1 diabetes, when they grow older, then they get thyroid cancer, then go do operation for pull the thyroid so that it not go kill them. So we get boku cancer. Cancer no more. We get over 100 of different cancers. But the one the way we they talk about na SALONE more. Now this breast cancer, prostate, and lung cancer. The lung cancer when I know say now from this
Cotton Tree Pharmacy is your new trusted provider of pharmacy services in Sierra Leone. You can count on Cotton Tree Pharmacy for genuine quality brand name and generic medicines. Guaranteed refills for prescriptions issued by doctors in Sierra Leone or abroad. Door-to-door medication delivery service in Freetown and beyond. Free health education. Have you heard about our Diaspora Medicine Connect? With Cotton Tree Pharmacy's Diaspora Medicine Connect, anyone can pay for your prescription online. Bring your prescription to 17 Pademba Road. Collect an invoice. Send your invoice to your sponsor in the diaspora. Your sponsor pays for your prescription online. We deliver your medication to you. For quality prescription and medications, visit Cotton Tree Pharmacy at 17 Pademba Road in Freetown. Have questions? Call our pharmacist on WhatsApp at 030.
So the other cancer where we want to talk about now, prostate cancer, where as I mean they say, then they said be very drastic in black men. So the risk factors then for prostate cancer, like we say for breast cancer, where you can get them from family. This again, if you're not black person, black man, you age over 50, your brother or your papa been get prostate cancer, you go get for they as risk for me you get this cancer also. And this cancer also waiting they happen now you
Why do a website when you can create an app for your business for free? Yes, with PAV App Maker, you can make an app as easy as pie.
So if you mama, if you papa be don't suffer from prostate, you brother, you're not black person, you do over 50 years of age, you need for know you symptoms then for make you go hospital. And what are the symptoms? Now just where you prostate they enlarge. Waiting at this prostate enlarge we will talk about. Man them prostate just they below them bladder. When nothing not happen to you, you young, you prostate okay. As you they grow older, it they enlarge. You prostate gland are the gland and the way they produce the fluid, where they take sperm, where they work out with the sperm, where they do my main daddy business. So whether they enlarge, the first way you young, you know where they piece how they send the piece go far, far away. Now when you prostate don't begin for enlarge, you know they send the piece. You they see some people then now when they piece the piece that drop, it just drop. You know they able for do anything. You know they able for peace, how you be supposed for peace. So when that they happen, then you know say you prostate gland don't begin for enlarge. And when that they happen, na bad sign. Some people then they know they get sign at all when this they happen. It can just they so. They know they get sign. By the time when they go hospital, they go tell them say that this don't happen to you, they not get long for leave. So the thing that we will for be careful of if you they suffer from prostate, you go begin for feel pain where they do my main daddy business. If you go in a toilet for go wet, you go see small blood inside the wet. Then the way where you be the piece first time now you go straight for peace, you go always get pain where the piece. So where you get all the symptoms here, so you go hospital. So take it there, you know they get symptoms. Boku cancer, they know they get symptoms at all. So now that the thing what they talk about today. Today na World Cancer Day. We talk about breast cancer where we already get a register of na SALONE, when a very good thing. The other thing again where now they kill we brother then SALONE and we papa them now the prostate cancer. Now we they talk about today. So I just want to see if people then they will not come online for make we welcome them. If they get any contribution, may them do contribution and tell we people they have for take care of themselves. So like what I mean they say the symptoms and for let you know say you get this prostate, you they wet fast, other than how you been the peace. And now during the next you they feel this urge for peace. The other one now difficulty for let you pass urine. Always when you go wet you they feel pain. Then the weak flow of you have in it. So when you be young, you they send the piece go yonder. Now the piece not get that strength again. If you see that neighbor dey happen, you need for watch yourself. Also take you there when time dey reach for let the you go wet, you just dey feel that urge dey quick one, you dey feel the urge for make you go. So that again na other symptoms back wey you go watch out for. We know say when you get diabetes you dey piss fast, you dey drink boku, but this now indifferent. So the weak flow of urine, the pain, the frequency, all that dey you get for know say you need for go hospital for make dem go check you. So on that note, I want for make we listen to one of we sponsors dem wey we get. Thank you.
Why do a website when you can create an app for your business for free? Yes, with PAV App Maker, you can make an app as easy as pie. It only takes a few minutes. Simply choose a design template you like, add the features you want, and once you are happy with the results, publish it to Google Play and Apple Store. So your clients can download your app. Go to tavappmaker.com and create your free app today.
Cotton Tree Pharmacy is your new trusted provider of pharmacy services in Sierra Leone. You can count on Cotton Tree Pharmacy for genuine quality brand name and generic medicines. Guaranteed refills for prescriptions issued by doctors in Sierra Leone or abroad. Door-to-door medication delivery service in Freetown and beyond. Free health education. Have you heard about our Diaspora Medicine Connect? With Cotton Tree Pharmacy's Diaspora Medicine Connect, anyone can pay for your prescription online. Bring your prescription to 17 Pademba Road. Collect an invoice. Send your invoice to your sponsor in the diaspora. Your sponsor pays for your prescription online. We deliver your medication to you. For quality prescription and medications, visit Cotton Tree Pharmacy at 17 Pademba Road in Freetown. Have questions? Call our pharmacist on WhatsApp at 030-611-664 or visit our website at www.cottontreemedicalgroup.com. Come to Cotton Tree Pharmacy. We are ready to fill your next prescription.
So welcome back. We dey welcome everybody where they join. Una call in, the number they go toll free, na UK, na US. So today na World Cancer Day. Wetin the cancer they talk about now for make we raise awareness for let people they know say early detection and treatments go save their life, because some cancer then they like the pancreatic cancer, you know, they give you no symptoms. The lymphoma wetin they do, they break down your immune system, cold self catch you, it go kill you. We don't lost a very good friend of ours. We friend in man, he just died in the UK. 2 down there, he not been get no symptoms. By the time we go hospital, he been get very short time for leave. So now the bad thing about them cancer, yeah, so frustrating self day, some people can get symptoms, some not they get symptoms. For the breast cancer, you go get like a lump where some day not even painful. You go get discharge from your body where not normal, you know, to comra, you not get belly, you they get discharge from your body, that as thing for sure say something wrong. Or some day you will get small notes then we on the arm, you go see the one and they don't swell, then they hurt you. If you get all the symptoms, then they do ya go hospital wherever you did. Na SALONE you did, na America you did, any side you go. If you see that kind of thing, they not see them do ya go. The other cancer will be they talk about just now that the prostate cancer, where instead it drastic in black men. Instead by the time when you go, they will give you diagnosis, say this cancer now you get. What it don't happen, you tell them reach for that, so tell you they go say you get 3 months. And the changes the way they look for, because everybody know himself. Woman, you know how you bobby there for where you don't be young girl, say you don't born picking there, or you're not even born yet. Because breast cancer they attack between the ages of 30 and 40. So when you dey grow old and they go dey send you say go do you mammogram, wey dem go put you body inside machine dem look if you get any abnormal lump dem, but not to all side get this kind facility. So you get for look you sef get for learn how you dey look you body and feel am with your hand for make you see if anything wrong. So the prostate cancer, the thing wey you dey look for, that urgency dey for make you go piss always. You dey feel pain when you dey do mommy and daddy business, and for go piss that's when na the problem. You dey go thin up, but when you thin up for piss, e go tey before the piss dey comot. You go feel say the piss dey comot, but e go tey dey before the piss comot. If that don begin happen to you, you need for go hospital for go check yourself. Then you dey feel say you don done for piss, when you no even piss better yet, all that day if you dey feel am, na you prostrate, na something dey wrong with. So when you dey get pain, when you dey piss, then when you dey do that mommy and daddy business, when you dey calm, you go see say you get pain. If that dey happen to you, when you know say not blast happen to you, if I may you go get checked. Then so taking day back when you dey do mommy and daddy business, you dey get pain. You dey get pain no more, you dey get blood, you know, when you go piss, you dey see blood. If all that they don't happen to you, you need for go check yourself, because that's a thing wey normal. So if then kind thing also they happen to you, you way they get symptoms, now for go for check. Now I make today now about awareness raising and early detection. Where they don't raise awareness, you go check yourself. If they detect say you get any form of cancer, you go able for treat them or they go able for treat you. Now we talk say cancer, now we all boku cells them come together and form a tumor. So taking it for call all them big cancer what they are, so it can difficult. But tumor, now where you cells the way supposed for don't die and go, and for the new one and come, not they die and go. Yes, caller, good evening. Who side they call from? What's in your name?
Hello.
Hello, caller, good evening. Who side they call from and what's in your name?
All right, my name is Edward Mara. I call from Philadelphia.
They call from?
I call from Philadelphia. You get me clear?
They call from Philadelphia. Good evening. How are you?
I do well. I really do well. Now, really interesting program and topic you deal with so. And I like the clarity and the way you explain them calm down so that, you know, the layman self will understand within this cancer they about. Like yes. Cancer is personal to me because my mama passed away 2 years ago of cancer. Well, that was cancer of the womb. So I don't know if I get worried or not. So, you know, when you explain and so, you know, it touched me and I think I get to call and then just ask. But we need to talk about it. Like people need for, like you say, early detection, you know, saves life, you know, and see how they go able to help with the medication and treatment, you know. So me and man and my mom passed of cancer of the womb. I get for concern, or my sister they get for concern. I don't know. Now you know the experts just let me know and take them from there. Or once again, like I say, I enjoy the program. The topic very, very nice and important. And also you talking about the prostate, you know, very important that as men we have to be on top of things. Okay. But then again, you will talk say when somebody younger, like when they pee or something, you know, like the pee they go far. But you think that age again can contribute to that? It not necessarily means say you get prostate, But like I said, I don't get no idea. You know, you have all the idea right there. You know, so give me some education about that. Well, basically that's the question I want to ask, and I want to say you thank you once more. I enjoyed the program, and I like the way you explain it. Very, very simple, you know, and continue the good work. All right. If I get any other question where I remember, I will try to call back before the program ends. But if not, I'll see you later, or I'll talk to you later, okay?
Okay. So thank you very much. We're sorry for Nancy, your mama passed away because of cancer of the womb. Yes, just because now you parents, you don't suffer and you don't die from that, you self need for they do checkup. Just like how they say man themselves can get breast cancer, but obviously man not go get womb cancer because man not get womb. But because now you mama you into na genetically linked, you can go begin have that discussion there with your doctor and then go advise you waiting for do. But actually, your sister then in particular go need for go and they do the screening, because when you screen for like a womb cancer or even the cervical cancer, then they go see you get abnormal cells, then they go able for treat you for that. So your sister there in particular need for begin discuss this with the healthcare provider. Say, look, mama die of womb cancer, wetin go do you dey Philadelphia, you know, like person like Angelina Jolie, e go for go do in breast and you know then do the vasectomy, the mastectomy then do for make them pull the body because he know say in mama die of breast cancer in auntie get her. So he see say he dey at risk, you know. So you self as a man still, just because that you mama, you go able for go make you people you medical team know say that kind of thing that happen at the family and keep an eye on you. And then particular you sister themselves need for do the same. Well, when I talk about the flow of urine, age can slow that as well. But it get for be a combination, not so one grade say you go say you get a weak flow. It get for be a weak flow, a painful urination. Then when you go to enough day, go take before the urine come. Then you go feel say you don't empty, where you not empty as you go back you feel. So it get for be like not a one or two of the symptoms there. So because even when you they get you know they get proper erection where you get prostrate, you it's very difficult for me you get an erection. That neighbor can be sexual dysfunction with diabetes. But what I can always say, anything will happen to you when a new thing where don't happen constantly, where you not been they happen to you last year, it begin happen to you this year, you need for go seek medical advice. Because then symptoms here, so it can be say the same symptoms when you they get for this particular disease, you they get them from the other disease. But it just be say now small changes they day because you they get that erectile dysfunction from diabetes, you they get had erection but had to get erection from prostrate, frequent urination, you they get them from diabetes, you they even get them again from the prostrate. But the difference here is you dey go urinate frequently, but maybe by the time when you get there, you don't wet yourself just because you prostrate down large. So we need for just educate we say read around anything where you know say they worry you. That if you get family history of you try now for you know for see wetin are you risk. But when it comes to prostrate, you're a black man, you're over 40, you get a family history of your brother seven get her, your papa get her, you need for take special measures. And all them cancer so we they talk about, be it bladder, colon, endometrial, kidney, lung, liver. Most of them things are things that we they eat. Somebody where they eat too much somebody where they drink too much alcohol. If you not stop, you know they eat healthy, it just they feed itself on alcohol. Wait till you go get try forget. You go try forget fatty liver disease, then later on you go get cirrhosis of the liver, which is a cancer. Somebody where they smoke or they taking secondhand smoke go eventually get the lung cancer. So all that here, some cancers and they where people that they get, I know people that we don't get lung cancer, we don't get liver cancer, they don't want to take alcohol, but not just the young genetic makeup because genes self they play a part in this cancer. You see, just how your cells and they manipulate your cells and they work, they make you get this cancer. But like what they say, the world also expand now. You they able for go and test yourself, early detection for any disease go save your life. If you go, you do screening, if not disease, then they go do screening for. If you go do your screening, you go able to get early detection and then treatments go be available to you. Because even when you come to chemotherapy in black people, now UK would also see loads of people they go for chemotherapy because they are black, the cancer be don't progress, they're not able to survive. We don't know why that thing happen. But you know, we own genetic makeup different. Even the prostate cancer is drastic in black men. Some not they show symptoms where they're gonna tell them say you get 3 months for leave. We're really painful because you be for able for save your life if you be go for screening. So now that's some more we they say today World Cancer Day. Let people then go do screening and get early detection and then they go able for save their life. I don't say possible where they smoke too much, where they drink too much, they know they eat healthy. Because even too much alcohol will give you some cancer. Too much sweets, you know, everybody they say sugar they feed cancer cells. So you never know what you they eat. Because if you know they eat healthy, you they feed on alcohol too much, tobacco now your food, then you they cause yourself or be at risk or expose yourself to all them cancer also. So today na World Cancer Day, we dey talk to people that about cancer, especially the one way we dey treat na SALONE, the breast cancer, the prostate, the lung cancer, wey na from tobacco or even toxins. People then they way they take harmful toxins. So now that's what we talk about today. So on that note, I go one for make we watch one video where they talk about wetin man dem for do for make them prevent themselves from prostate cancer. They say too much mommy and daddy business. If you dey do too much mommy and daddy business, like 21 term inside the month, you go able for prevent yourself. You just start where you get pipe, you dey clean the pipe. So it look funny, but it's serious. When this doctor yeah, they ask him, he confirm him, say yes, if you do mommy and daddy business, it's like you dey clean your pipe, you go able for prevent yourself from prostate cancer. So I go want for make we watch that video there now. And we see they welcome people that way they join with phone in and ask questions or make your contributions. Thank you. Lord, watch the video where the two doctors and they talk about prostate cancer, please.
Preventative practice for men for prostate cancer.
And what is that?
Sex.
There you go.
Best item we ever ran in this. Men across the country cutting it out. The more you ejaculate, the lower your risk of prostate cancer. On refrigerators across the country, nightstands, you name it. What's the truth?
The truth is that there is some truth to that based on a huge study, a lot of puns in this conversation. Let's excuse them all now. A huge study
Right.
Looking at over 30,000 men for about 10 years, published about a year ago, showing that men that ejaculate at least 21 times a month,
21.
average, and they started studying the men. The male group were from the age of, between the ages of 29 to the ages of to their late 60s. Average 21 times a month had a lower risk of not only prostate cancer, but even the more aggressive type of prostate cancer. So 21 times a month, what do you do with that information? Well, clearly you know what to do with that information, but what if your partner is not into it? You have the type of partner that's, there's no way they're gonna,
21's a lot.
It's a lot. It's a lot. So, and they didn't differentiate with partner.
Right.
They didn't differentiate with partners, more than one, and they didn't differentiate with those that just took matters literally into their own hands and masturbated.
Right.
It was just
It's
ejaculating.
just the use of the plumbing. Right.
21 times a month. So still a lot. Still a lot. Although some men would argue against that.
Depends on your age. Depends on your proclivities.
On a lot of things. But that's what the studies show, with no clear indication as to why that is. And some theories include that, you know, about 70% of the semen is produced in the prostate. So if you don't let that out, it kind of clogs up the pipes, if you will. There's also antimicrobial properties in semen and sperm. So when a man ejaculate, they're literally cleaning out the pipes as they ejaculate or when they ejaculate. There's all of those other factors that are probably the reason why. But I'm just the messenger.
All right. It's a good message to say. All right. Probably the best video we've ever done. Men, get on it.
Literally.
Let on it.
All right.
Thanks, Dr. Gio.
You're welcome.
If you liked what you just saw, we have a whole lot more with Dr. Gio Espinoza at our website, bottomlineinc.com. And do me a favor, share this. Tell your friends. We have so much great information. Come to bottomlineinc.com.
Okay, so now you bottomline.com say ejaculation 21 times a month helps clean the pipe. So whether it's with multiple partners, it's with your partner, your wife, whoever, you need to do this. Men, get on there and do it and clean that pipe. We don't want our men dying from prostrate. So go clean the pipe, please. So I be tell you, say it look like saying some funny video, but it's real. And they say a study they do where they come to that conclusion there. So if I make we encourage women and we the woman themselves, you know, say we always tire, we don't do this, we tire. If you want to let your man live long, let provide for you, and men you and you picking them, let live long and work and do something you need for help and for clean this pipe, please. So on that note, we will play with second video and we move on from that. Thank you.
As the most common cancer in men, understanding prostate cancer is vital. So I've come to Cambridge University Hospital to speak with Dr. Vincent Nanaprakasam to find out how they go about diagnosing this common cancer. Well, Vincent, prostate cancer is notoriously difficult to diagnose, isn't it?
Indeed. In fact, prostate cancer most often has no symptoms. A man might go to his GP because he has noticed a change in his urinary symptoms, getting up at night maybe, or having difficulty passing water, and most often that's due to a normal enlargement of the prostate as he gets older. In fact, prostate cancer doesn't cause any symptoms unless it's very advanced, in which case it might mimic some of those symptoms of an obstructed or large prostate. But if there are any concerns, the first step is to go and see your GP, who can then investigate further.
So what would your GP do?
Most often what they'll do is take a history from you, do a examination of the prostate, and do a PSA blood test.
What is a PSA test?
So PSA stands for prostate-specific antigen. It's produced by the prostate gland, and it's a marker for the presence of prostate cancer. However, it can also be raised in other conditions, so it's not a very specific marker, but it's the first test that we can do to say whether we should proceed to further investigations.
So what happens if you get sent to the hospital for an examination?
The specialist will see you, again take a history and an examination, and then most often what they will do is arrange a prostate biopsy. Increasingly, they might recommend a scan to be done first, an MRI scan, and then discuss with you what the best way to do a biopsy is.
And if it is cancer, tell us what happens then. Tell us about some of the tests.
Well, a discussion then starts. The first step is to make sure that we know exactly what kind of cancer it is, and that might involve other types of scans, for example, a CT scan or a bone scan. The kind of cancer is determined by the size of it or the stage of a cancer, and once the specialist puts all that information together with what the biopsy has shown, then they start to discuss with you what the treatments are.
So, now we know more about the tests, and the good news is that the majority of men diagnosed with prostate cancer survive for 10 or more years. For further information, visit the Cancer Research UK website or see the other videos in this series.
Thank you. This is all about prostate, because really, like I say, we people in our salon, we man and they suffer this. You know, we older man and they suffer this too much. Yes, I saw 2 days ago, hello. Yeah, we need to ask the men to clean the pipe. They need to because we want them around to help us take care of the kids. Mikhail, I watched my father died of prostate cancer. I'm happy I have a girlfriend that is always ready for me. Way, that's good, girlfriend. Go there and help the man. You don't want him to die of prostate. You need to let him clean the pipe. So, yes, we're talking about World Cancer Day. Early detection and treatment save lives. If you know, say you don't get some things that were abnormal, things that will not be happen to you before, do ya and for go hospital. Because cancer, some cancers then they will not give you no symptoms. So do ya with a big. And when you see something like even the leukemia, where now the cells and just they multiply and they cause damage, and they happen to picking them. Una where they London, if una go na Great Ormond Street Hospital, you see small picking the way they suffer, they not get here and they hate because of the treatment. Then the guy, then they with drip all day long. You know, say cancer, not a thing we not thing we not pleasure forget. No sickness they say we not pleasure forget. So do ya make we try and do early detection. Thank you. Thank you. Hello. Yes, ISA 2 is a great topic. We need to just educate our people, especially here in Sierra Leone. And we dey glad for SALONE because they don't establish the cancer register. No more we dey try now for them. We get the palliative care side, where if they don't tell you, say, well, you get so much time for leave, side where you go, where they go care for you like a hospice. Because you know, nice, then you go there tell you, say, where you get 6 months for leave. Then you go back to you people that you see how everybody they go up and down. Most people they not go even get temp for you that way. But if you get the specialist nurses, then you get the hospice, outside people that go to visit you, then they hold you with that tender loving care, you know, it go good for you. So now that's what they try back for lobby for Moko get side what they do, the palliative care where people that go die in the most comfortable state. Yeah, so cancer cells, they form where we cells then they not they die because you cells them for live for some time, then die, new one then come. But it be cancerous where this cancer cell, where you cells and not they die, then they live, they multiply, then become very uncontrollable, and then they go bunch into other, then bunch together, make a big mass, then they tell you say you get cancer. So may we go for tests, you can go for screening for breast cancer, you can go for screening for prostate cancer, you go do MRI scan where even SALONE then go do and then go do blood test them. So now this we talk about today, World Cancer Day. Then we test early detection, we save our people's lives. So we see they welcome the one the way they come, we see they talk to people there about the cancer and we see them for do. Like I mean they say genetics, you gene them, you parents them. But who cancer the way people they get when now waiting and they eat, they give them the cancer. Other one and they when now you from your parents say you go get her. So if you know say your mama don't die of breast cancer, do ya? May you medical team know so they say go do something for you. If you know say your papa die of prostate cancer and you not man, do ya? Now for go so you doctor, you tell them say nadana your history, and then do the screening for you. Because then do the screening for you, they'll be able for know if you they ask risk and begin for tell you waiting for do for let it see so no more na you. We get Shabro sister, we talk to we in Shabro about breast cancer. I go want for police to them. After that, Mr. Go can conclude. But during that time, if possible, you want phone in, you can still phone in. If you want for do a contribution, you can still do a contribution. We still get time. But I just want for make we listen to what in this shape where woman say because we must get people the way they understand Shabro, way they salon. Now make you say, make you do this video, let instead talk another language way. We know say people see they talk up. Thank you.
Pike bami apike wate mami apike sakanowe nande yang yalo wantino alo wano yalo Fatima takuruma ini gbem ninga manako alo wantino alo wano alo kumono nande wol de enwengun nande cancer nande lokolanwe labini ahun ni no la wom because yang akon kebel ko cheka ye radio asian yamayin bamamin petemam de ngabingo ngalati ngalona wom naku wai ko kie labin ate kan bon nako no machal hospital la mo botant mo ko mo ko report e labo hospital selon kan no se o montanti mo ko because nako ki ko bin tambasi oki ko ira ye labon ko tambasi bulle si mo ye ngake ya yetie mo ko bibal no bisila ko bibal ka labo balle ko mo atuk mo kekut ni ke balle ko lo ko chilon pa bi ko neki mpa gbe kan ko no hospital lai mo ko report wa kan ki ngaka ni ko mom de labini ahun e labo na ke cancer ve ko e pomo la wom e labo che kongwe pomo la pe wom e la wo kolobo me ka tin mom tungalo si no bi lo balle mom tungalo ka balle ko ne ko mo te tungalo kon be ko te kat le ko mo ne kin do embul rentin mpa gbekni go report hospital like na bo cancer ko e pomo la wom me kara bol moki bolle yanke ya ko bande bolle e la bo kopit bolle kopit mpa gbeknu mo like wo e la bo pe bol mo ko lo ko mo e okulle la bo nchen lagbum ni manda malo e ponga woko mo ko mo e ko report e la bo ko loeni bolle mun ko komino pe loeni ko nunu ko e loeni mo e ko report e la bo nake ko e pomo la wom e la bo te nake ko e pomo la wom biko nake ki komo ko we wante mami ya mami ko kaka ngayeti no nante koko yeti no ekeke nantu kongo no nuwang ngakoni nante kwanya tinde komo bunda likit kaya le nko hospital lai pomo ram nsung la ye nko bonko teni tang malande ve mpa ko hospital lai pomo ram nsung gbi yen ba chumonga kala bon te kan symptom de be gbi tambasi be nkuma te kan gbi ni ko ni bi ayin chalo lo bo wongo inka bo ko mo yeti before mon pe member bol ngale kipe kon be ko kukui awa kon po chumo pe bo ngaramul kala bon ko te kan be gbi ngoko ngangan be mo pa ko ni yon kon bo po mo ramul nsong njela besi jambon limla even mba mami ngan pe nga soto labini awomola ngombe la bobon momo ko tpanaki malapo nko la wom doctor bon mi mo ki koneki labini anun mi komo mbe mo soto labi machal kone abanami wante mami ya mami labo ewe yangalo wano labini awom no la ngamachale nakeki yo no bukan bo kaka yes nimpa ko ni pomoramul sung ken chala bo wongo no ngani mo bani wosowe mo bani pomte ta cheramul njelasi komor gunda kala bo ngan be gbe mo bo tek ne mpa ko ni nkola tungi pomoramul ni sung chan bo ni lem la wona ke ko chempa ka pomoramul ni sogu pincha be pesi so labini awom do en nande lokolande ngo enande si pongo inan bi ngo ngunde polawo nan bi polawo so labin lokolande nande wol cancer lokolan we nande labin ngun ni no lawom albe nga kon kebul ko asi ndo bi radio te talomo ngala niti sekono we ano chongo saka ngaya ngalongom nuye ya lo wantino alo wano awalabue osawe.
So I hope say we shabro people them. Yeri down there where Fatima Takoma they tell me about breast cancer and waiting for do for go hospital and the overall outlook for this cancer awareness. Now, because of people them don't do lots of awareness of the cancer and people then they go for early detection. Now don't make the cancer don't begin for be under control. Then again, when they talk to people about smoking, because Boku sick de now when this cancer sick when from this smoking yeah it come up. If you're obese, you fat, the people that weigh getting 400 pounds, 600 pounds in weight, they eat too much sweets, people that weigh they smoke too much, people that weigh they drink too much alcohol, all that are risk factors for make you get the cancer. But right now, the improvements of the cancer will not happen now because people then they go for screening and then they get early detection, then they're able to treat them. So when person get cancer, the outlook on that cancer they depend on who side the disease come up, who side is spread, how is severe, and who side it dey. Because every cancer get for start from somewhere. You dey read and say somebody get breast cancer, but it don't spread to in lungs, it don't spread to in kidney, it don't spread here, it don't spread yonder. But the name when they get na from who side it come out. If somebody get breast cancer, it spreads to all in other organs then go say na breast cancer again. If you get lung cancer, but it go to your liver, it go to your kidney, it go all side, still they go say na lung cancer you get. So the takeaway for today, cancer cells then they multiply uncontrollably, it prevent them from many and die. It prevent the cells and for many and die the way they're supposed to die. When the cells and they multiply uncontrollably, they know they die the way they're supposed to die. So what's then they do? Then they go bunch one place, then form a big mass there, then become a tumor. Now that they make people and they get cancer. And again, genetic, like what they talk about genetic people, the way they cut them bobby because they get their mama they don't suffer from breast cancer, people the way they suffer prostate because their papa they don't suffer from prostate cancer. So genetics have they play a role in all this cancer because you they get them if you possibly don't get them. So with DNA again, how we God make we genetically instead of get another role for play because your DNA now go communicate with your cell them for make you know how the cell they divide, how then they die, how then they come back and cluster together for cause this sick here. So we need for no say cancer and not they just happen so. It happen because of loads of reasons. Sometimes it not just genetic makeup, sometimes it not what you they eat, sometimes it not what you they drink. But some people then still they where they suffer the cancer, they don't want they drink, they don't want they smoke. Somebody they way don't smoke and they tell you say don't smoke, you don't old 90 years, you know they cough safe, you know they get lung cancer, you know they get anything. So person a young genetic makeup. So nyabunde si ha muwa komuye po gama kolongo himbeji matatu ya cancer himbeji maluwango wanuga te laibe mate ye pepe fa ti lebe numu indetima ji nyahen ba jembe bele nga fonu sawa gboyongo ma kabiya ma gbo vi balokole ngamena agbiabuma botande te klabu himbe manu jima wala inginda ba wa hunge wa gbo gbele maluwango wanugbe elu yepe ye himbe nava yena na anumu nyini we yibi nyini na ho makaleti tete yipe numu aleti nyini le maluwango wanugbe agwa yepe yete na pe hush nugbe yepe kolu monama so ye himbe jisi anyadego ena be salolo Little akabinyini ta change mana hiwe hi anawo aye na ya otibile abinde galia obi andole si abinyina na ya na enabutu aka binyini na ta na shepi e ka buma obutu aka ya na siawo na Cornell Hospital titi bigbe ti ko ena hingbe ne mabuma because bi hu bo ali hospital ti bigbe nga ta go ti le mate okay hingbe jime buma so mubuma muba hai omo nyini jimute ko bugu binde vungwa majo so Cornell nya woman ne ma hingbe gbi ya nu buma bi hu bo ali highway bu ta go to be high because from a Monday mamoe World Cancer Day ko Monday nuga mamoe hingbe gitana ke bi ya highway bu ko titi bi mangbe ti ko ke hingbe jime buma bagwo bi ba ya majo so Cornell mo vi la mo bonda go bukaka ge bi mo bonda salonji highway bu ko maluwa go livana tenga na bai na sebi we pepe go tenga na bai lo na vo bi ya ko be high ya kena de gbiwe ma the highway bu titi bigbe because bigbe nga tu mo akoke hingbe lo ma tagwo ti be high Cornell mo bonda mo vi la go bu ma woman ne hingbe ji ma luwango kenu bu humbo ahun go ebuwa kebi here ha jele flower hu on jele lewe hu then hingbe abuwa lo Cornell mo le muma so mo ko mo ge mi ha mo segba uma na pe tuwa ti na gbe ma mo ti mo gbe ma mo segba ti ma wa bo ma next week ko mo hai yepe kale because kan gbe tami apatele no ina buga gbe ango gbogbo be bi ya ke na le buga gbe gbatengo because no gana ti gbatengo ke kan gbo etwe ti me be yi ti ehun abete kuta me ke no lu ina be velingo ke hibebibima tamanyande go dunyejo. So on that note, I think we call it a night. Let people know that early detection of every sickness will lead to cure and save lives. Person, when you get any sickness, if you go quick, then go say yes, you got this sickness, then do testing for you. Then tell you saying that this sick do you, and that this not the medicine. It will make you not go die. It will save your life. But if you get sick, you don't go hospital. You keep an host, especially the cancers and any of them non-communicable disease. Yeah, it can't to cancer or it can't to hypertension or it can't to diabetes or it can't to the one when your respiration where your lung back will get problem or you get asthma or you get stroke or if you not go hospital, that's the way go monitor you. So any sickness where we get people then we go hospital. We not say I can always say people that don't get bad experience for going to hospital, but you go. Until that day they not so you don't turn for die. God will send somebody we get passion of the work way they do. God will send somebody we go leg for save somebody in life. That person they go save your life. So I think say we go stop there today. We welcome everybody and say thank you.
Why do a website when you can create an app for your business for free? Yes, with TAV App Maker, you can make an app as easy as pie. It only takes a few minutes. Simply choose a design template you like, add the features you want, and once you are happy with the results, publish it to Google Play and Apple Store. So your clients can download your app. Go to TAVAppmaker.com and create your free app today.